What are your tips for clinicians who are struggling to stay up to date with all of the news and published literature about COVID-19 while trying to respond to the pandemic?
Yeah, I think that's a great question for which I probably don't have a great, the best answer. I don't know what the best answer is, but I can tell you what I've been doing. I think for all of us that are involved in this pandemic, it's long days. You go to bed late, you wake up early. I'm frequently up very early in the morning, and I would recommend to those who are struggling to find information to find a couple good resources on the internet and frequent them every day. Sign up for table of contents or COVID alerts through organizations or journals that you trust or like to read. I frequently go to Lancet at least every day looking at new publications. I go to the New England Journal, has a really good website, and their spinoff Journal Watch also has a really good website on COVID-19. CDC is a really good place for up-to-date information. There's actually a pharmacy website called ID Stewardship. They cover a lot of ground in infectious disease pharmacotherapy and antimicrobial stewardship, but they have a regularly updated section on all things COVID, and I go to that every day looking for new things. I'd also recommend people review publicly available protocols and guidance from, examples are Massachusetts General Hospital, University of Nebraska, University of Washington, the University of Wisconsin at Madison. There's others, but, go to those websites and look at their protocols, look at their recommendations for infection prevention and triage. I mean, PPE, all that stuff is really helpful. Another thing I find helpful is just querying medRxiv, which I cited before related to the Losartan paper. But that's where scholars can upload manuscripts that have been submitted or will be submitted but have not undergone peer review, and then others can view them. Now, that's sort of a catch-22 because when stuff has not been peer reviewed, it hasn't been officially vetted, you have to take it with a grain of salt. And some of the stuff I've seen on medRxiv, unfortunately, is of lower quality and not helpful. But there's a lot of stuff out there that's been, investigated and written by notable authors who, have a track record of high quality publications and contributions to infectious disease science and therapeutics. And that's going to be another good resource that you should probably check at least every day, if not every other day. But again, it's not peer reviewed. And then finally, one thing that I check multiple times per day is the Johns Hopkins database that tracks all the COVID cases throughout the world, as well as mortality. So you can track that. For example, you can hone in on the United States. You can see how many cases we have confirmed, and then you can even drill down on state or city. You could pick it like New York City, for example. You can look at those data, or wherever it is that you're working. I live in Wisconsin, so I frequently look at the Wisconsin data. And then there's also another really great website that I think is important. This is more from a 30,000 foot view, looking at the social distancing piece of things and how are the efforts we're doing, at social distancing impacting the slope of the curve. It's called Flip the Script, and it's a website where they take the Johns Hopkins data and they plot it out in a logarithmic fashion and also in a linear fashion, and it does it by country and it does it by U.S. state, and then you can also do it normalized by population for country and U.S. state. So it's really nice, and I find myself going to that frequently, just looking at the United States curve. Are we tracking with Italy? Are we tracking with Spain? Are we tracking with South Korea? We're not tracking with South Korea, but just kind of look at the trajectory of the curve, and then I can do the same thing for Wisconsin. And then one other thing I would probably just plug that I think is really informative if people haven't looked at it. This was a medRxiv pre-pub, but it was a group of researchers out of the University of Washington. And they did this sobering analysis that was remarkable in both its scope and its granularity. And they looked at hospital beds, ICU beds, and ventilators for every U.S. state. And they looked at how the surge was going to roll out through each state. And when they estimated what the peak surge date would be, for Wisconsin, for example, it was April 27th. And they said, this is how many hospital beds you'll be short, how many ICU beds you'll be short, how many ventilators you'll be short. So I think as we all try to manage our expectations with this pandemic, that publication, and then they also have a companion website where you can visualize your state is really informative, and I would encourage people to look to that as well. So obviously that's a lot. Maybe you don't have time to do all those things every day, but I would suggest finding probably 30 to 60 minutes if you can every day to look at some of this stuff and print papers off and try to stay ahead of this, because it's unlike anything I've ever seen in my career. Just the pace of new information and data, it's hard to keep up. So you have to come up with a system that works for you.